Good afternoon to all of you. First of all, really big thanks to Dr. Jasmine Shah for giving me a platform to come and share as a homeopath with homeopaths. I have been doing orientation for past 5 years with schools, colleges, teachers, students, children, lots of handwriting improvement besides homeopathy. Homeopathy तो है ही, वो कहीं जाने वाला नहीं है. इस लाइफ टाइम में वो बंद गया है कि वी आर होम्योपैथ्स. कम वॉट में वी में प्रैक्टिस, वी में नॉट प्रैक्टिस, बट आर थिंकिंग, आर व्यू, ऑब्जेक्ट और सीइंग कैपेसिटी, एवरीथिंग एज एन होम्योपैथ्स तो इनग्रेन्ड है ही. बट एज ग्राफोलॉजिस्ट दिस इज द फर्स्ट बिग प्लेटफॉर्म फॉर मी. There are my friends and colleagues who we have a group and we are doing lots of research related to graphology, health, homeopathy, but in our own small way. This is where I am sharing a platform which always I cherished too. So thanks to Dr. Jasmine Shah and his team and for you all for listening. So I begin here to start on graphology. Can I know what you all know about graphology?
Handwriting analysis. It actually tells you the makeup of the person. And I have seen cases where a graphologist tells you how to alter your handwriting or your signature for the betterment of either your finances or your relationships, wherever you are going wrong. Like a change in handwriting helps that.
Yeah.
I don't know how much it's the
Graphotherapy part you're talking about. Yeah. That's a therapy. Yeah. Yes. But what it is exactly? What is graphology? Study of patterns of handwriting. For what? Of personality. Mental makeup.
Certain behavioral traits can be behavioral, so you can express your moods through your handwriting. So that's a very important aspect where you can actually control that
Yes.
mental makeup.
Yes.
If it's in the positive directions and the negative direction, the way the handwriting moves. I mean, I am not
Yes. Yes.
fully clear,
Yes.
but,
You're picking up the.
As in it changes with our moods.
Yeah.
With many people, the handwriting changes with their moods. So if they're in a happy mood, they'll come up with something nice and legendary. If they're distressed, they might just scribble something off.
Or a general trend, if your handwriting moves in the right direction, where you put the full stop, when you're putting the dot over the eye, does it go beyond the eye, before the eye? You know, it has certain significance.
Lots and lots of significance. Yes.
I don't know if this adds to it, but considering the pathology part, even people who are suffering from certain serious disorders, they suffer from micrographia. For example, like people who are like, if there is cerebral affections, then the fine movements are affected. So the handwriting, I mean, I don't know if it is.
Thomas Alva Edison had micrographia. Okay, partly you all are true. It is partly. It is like a portrait of Mona Lisa. वो दूर से देख के will say yes, this is Mona Lisa. But the finer nuisance of it, the science, if handwriting was going to change with moods, many people come with pens, many people come with paper, many people come with table. So many different situations and different things, my writing changes. My mood, my writing changes. If that was it, we were not here. It's a science and science will see beyond this, not superficially. We see the stroke formations and not the handwriting pattern. To start with, I'll give you my personal experience, how graphology, since you said you attended a few sessions and then it was this. For me, it was 8 years back into my practice of homeopathy when a case of migraine came to me and I was not able to successfully really help the client. So migraine hai, sun mein jao, khana nahi khao, typical all these Indian natremure females what we had learning at that stage of our evolution or study in homeopathy, not healing, sab kuch de ke rakha, what is happening? So somewhere I felt that the patient is not really revealing the true aspects of what is happening to her trigger thing. These are all trigger factors, but what is actually causing migraine? So came graphology into picture. So let's study his the person's handwriting, and that will help me in my professional growth. And from that day onwards, I still remember it was monsoon, June, 8 years back. We had shifted into a temporary accommodation since the building was getting demolished. So all these setting of a new place, new things with children was a mess, and there was this orientation on graphology. In spite of heavy rains, no, I want to do it, and since then it is no looking back. It is like it has changed my life path to such a degree, to such an extent from inside out, that this has become a passion. Homeopathy to hai. Then came hypnosis, then came theta, then came chakra healing, then came color therapy, many these different therapies, which in fact after these years all my friends used to, why are you diverting yourself, why are you not focused, why are you this, why are you that? It was like always bombardment. You are running away from homeopathy. Why don't you put in so much passion only in studying just one remedy a day? Why are you doing all the many things came in my way. These were professionally, house-wise also, many difficulties did come. But end of it, the fruits are, they just solidified my pillars of homeopathy. It is nothing. Sub holistic remedies, healing are going to reach your subconscious. Any approach you take. For some it might be just relating to some Baba or some listening to some spirituals. For some it might be Osho. For some it might be Ram Krishna. Anybody. Somewhere where you are just not you and it is you from you, within you. So for me, graphology was such, and that's why I'm here. As homeopathy is a science and art, so is graphology science and art. Anybody can help me, you MDs, with what is the science and art of homeopathy? What is the art and science? Homeopathy is art and science, everybody agrees? A big yes, I can't hear. Yes. Homeopathy is art and science, or it's only science? Art and science. So बोलो science क्या है, homeopathy का और art क्या है?
Logical principles of law of nature and
Similar, current, one of them, yes.
And art is where you understand
Perceiving the creation and
analyzing what is to be treated and what not has to be, what can't be treated, what can be treated.
My dear friends, you all got a chance to come here. For me it was something else. End of 4.5 years, what we learned from our colleges was what did we learn from our colleges? It was just the science and the scientific principles. Did we learn the art?
No.
Did we know how to give a simple SL ka packet? Did we know how to wrap it? Unless somebody has been sitting over there. Simple prescription, did we know how to write? So science and art is different. So homeopathy science इसलिए है because it is based on solid principles of similia, minimum dose, individualization, potentization. Come on, you all have to say this. I'm here for graphology. Proving. And what is the art of homeopathy? Case receiving. Please. If we have to receive, we take करेंगे तो take ही करते रहेंगे. Receive from the client. And how do we receive? What are the principles of receiving?
Unprejudiced observation.
Do not interfere.
Silent observer.
Silent observer, unprejudiced. Then, is it not the art of prescribing also? When to give, when not to give, which way to give, which way is either liquid, inhalation, this. To be very honest, do we have all the medicines all the time when the client requires? Most of the time we don't have. So what do we do? This all is art. कि patient जब जाए तो वो हंसता जाए, satisfy होके जाए. वो कैसे करेंगे हम? How can we do it? Graphology helped me do that. Believe me, I have been shifting my